So let's go ahead and start and review the autoimmune pathophysiology like you did at IPS. Let's give the audience exactly the full feel for what doctors were taught when you were speaking.
So unfortunately, the spectrum of autoimmunity is multifactorial. We usually think of it as both genetic, starting with genetic predisposition to having disease, and then progressing on through a complex interplay of factors: environmental toxin exposure, personal or emotional stressors, illness or infection. In fact, most autoimmune diseases, if we're specifically talking about the creation of antibodies against self, most autoimmune diseases start with some degree of, or at some point encounter some sort of infectious cause. And we've seen relationships between rheumatoid arthritis and periodontal disease, and this is an infectious component. We've seen Klebsiella related to patients with MS. And so these, or herpes virus related to patients with MS. So most of these have some sort of immune component or infectious component to them that's sort of a secondary trigger. So they start with the exposures that we have, all of us in our environment, and then they become, either because of a sedentary life where you're not removing toxins adequately, or because of exposure to an illness and some sort of infection, there's this trigger of this auto amplification of autoimmunity, where it begins as just a normal process that's supposed to save your body or help your cells respond appropriately to trauma or infection. It becomes a place where you instead, your body begins to continue to do that inappropriately, despite the fact that either the original trigger is resolved or because of the storm of chemicals that goes on. So patients are experiencing this chemical storm of, and I heard Betsy talk about it a couple weeks ago, TNF alpha and IL-6 and all of these inflammatory chemicals that get produced appropriately, probably initially. Now they're being produced in an excessive manner and continuing to create, maybe from what used to be a small nidus, now it involves not only your left knee, but your entire body.